afternoon, fellow students. I want to thank you personally for giving graciously of your time to listen to some of the points that I would like to make about dental hygiene. Now, is dental hygiene, brushing and flossing, is it a nuisance or is it a necessity? I want you to think about this quote, rather the statistic. Contracting this disease increases your likelihood of developing cancer by a staggering 63%. That is a huge percentage. And this disease is also known as periodontal disease, and you can prevent it very easily. It's easily preventable by brushing your teeth and flossing. As you will see, there are several associated health risks that scientists and researchers have been discovering that is linked directly to periodontal disease. And these include simple things like self-esteem issues, in addition to coronary heart disease, heart attack, cancers, and prenatal issues. So the question remains, is dental hygiene a chore, or is it something that we should give more attention to? So we all know that brushing 2 times a day for 2 minutes, in addition to flossing and going to checkups, is kind of a chore. It can be a pain or a nuisance. But it is something that is important in keeping your mouth healthy, because an unhealthy mouth with increased bacterial growth can lead to discoloration of your teeth. It can lead to infections and tooth loss. The bone is breaking down from the bacteria and the decay. There's increased invasiveness, which means that you will have to undergo a surgical procedure, and that also costs money. So when you get into fillings and crowns, root canals, prosthetics, all of those things cost more money and more frequent visits. So one of the side effects that I have already mentioned of periodontal disease or issues with poor oral hygiene is a self-esteem issue. This is not necessarily important medically, but this is an area of research. People who do have issues with their teeth are less likely to smile, they're less confident, they have a self-perceived altered aesthetic, or kind of a self-perceived ugliness. You know, how is this person viewing me right now? What do they think? These confidence issues can carry over into the rest of their lives, you know, when they go for a job interview, or if they're taking photos or pictures. These self-esteem issues that are directly related to poor oral hygiene can be an issue for some individuals. On a more serious note, medically, periodontal disease can also lead to coronary heart disease, and this is a major area of research right now. The inflammation caused by periodontitis can lead to arthrosclerosis. Additionally, myocardial infarctions have been directly linked to periodontal disease. The increased inflammation in the area can lead to an increased platelet aggregation, so platelets come to the area of inflammation and the infection, and they start to aggregate, and then this can clog the arteries, therefore causing a heart attack. And according to Mohidi and Redasani and some of the research they conducted, a study in 2012, quote, subjects with periodontitis had a 25% increased risk of developing heart disease compared to those with little or no periodontal disease, end quote. So this means essentially that 25% increased risk of developing heart disease is associated with periodontal disease. And again, this is a new and upcoming area of research and an intense study with this link. Additionally, and even more seriously, there is a direct link and correlation with periodontal disease and cancer. Because the inflammation releases chemicals, the bacteria that are causing the infection will have a field day in this individual's mouth, and they release chemicals such as nitrosamines, acetaldehyde, and some carcinogens. And as these travel through the bloodstream, cancers such as oral, obviously, esophageal, the esophagus, the lungs, gastric cancers, upper GI tract, pancreatic cancer, and kidney cancers, anything that comes in contact or is filtering the blood, can be linked to periodontal disease. Lastly, prenatal issues are of major concern at this time because a pregnant woman that has contracted periodontal disease has all this bacteria harboring in her mouth, a large bacterial load that produce these chemicals in simplest terms that will induce premature labor, which of course we understand can cause a stillborn birth or a premature baby. And according to Shermohamadi, Porabas, Bilan, and Shitsatsi, in a study they conducted in research in 2009, quote, birth weight, the height and head and chest circumferences of babies born of mothers with established periodontal disease were significantly lower than those who were born of mothers with healthy periodontal condition, gingivitis, and initial periodontal disease. So this means with periodontal disease unchecked in a pregnant mother, she runs the risk of a premature labor, induced premature labor, because of her periodontal disease. So oral hygiene does in fact keep bacteria at bay. Dentists who have prescribed these daily regimens, we do now know, can prevent all of these previously mentioned issues. So fluoridated toothpaste is sufficient, as well as flossing and deep cleanings regularly with a dental hygienist. This provides a deep clean, and this is sufficient in keeping bacteria at bay and preventing a lot of these issues. So in closing, oral hygiene is a nuisance, but it is a necessity, and we do now know that this has been confirmed through all of this research and up and coming studies. So poor oral hygiene and periodontal disease can contribute to several issues. I mean, self-esteem issues, coronary heart disease, heart attacks risk, and cancers and prenatal issues. All of these things have been linked to poor oral hygiene. And much research must be conducted to address the prevention and treatment of these diseases. We have sufficient ways to prevent periodontal disease, but there are a large amount of researching facilities that can go and look at what periodontal disease will affect in individuals in the future. And these things are things that students like ourselves in pre-medicine and researchers alike can be interested in. So it is an up-and-coming researching area and very fascinating. So thank you for your time.